This episode of In Focus is being made possible through the support of the Wayne County government.
I wear my mask to keep my family and friends safe. I think it's important to wash your hands because it wipes off the germs. When I play with my friends, we stay 6 feet apart. Keep wearing our masks so we can stay in school. I wear my mask so people don't get sick. I think it's good to wear your mask because it encourages other people to wear their mask.
Welcome to this week's In Focus on Whitewater Community Television's WGTV Channel 11. Thank you very much for joining me. I'm Eric Marsh, Executive Director of Whitewater Community Television. I'm glad to have a little time to spend with Dr. Thomas Huth, Vice President, Medical Affairs at Reed Health. I have to make sure I say welcome to In Focus because obviously I spend time with Dr. Huth on Friday afternoons for a program called Ask the Doctors, where he and Dr. David Jetmore for 41 weeks have been answering your questions. So if you haven't had a chance to see that show either live or in replay, you might want to check that out. We are getting a lot of questions on our Facebook page and other places about what's happening with the COVID-19 vaccines and when people can get vaccinated and things of that nature. So we're going to turn to Dr. Huth and see how much of that we can get answered in the time that we have together. Doctor, thank you very much for spending some time with me. I always appreciate it.
My pleasure. Always ready to help you, Eric.
For those who don't know your background, real quick, give us a little background as to how you came to Reed Health, what your specialty is, and what you do as Vice President, Medical Affairs.
Gosh, let's see, the shortest possible version, because as I've been around a long time. I've been in medicine for over 35 years. I know I only look like I'm about 25, but you know, some of us are blessed with
fresh out of med school.
You and I grew up in Cincinnati and went to college and medical school and did my residency there in internal medicine. And so I'm an internist, and a lot of people don't know what that is or aren't sure. It's kind of an old-timey term. It was the original medical specialty. There were sort of general practice doctors, and then there were the internists who were sort of the specialists, and we're talking 125 years ago, 150 years ago. But basically these days, what an internist is an adult doctor. So I'm kind of like a pediatrician who knows everything about kids except for adults. And that's to distinguish that from, say, family practice, where a family practitioner knows a lot about all the age groups, but maybe not in as much depth in particular areas. And if I concentrate on the adult edge of the spectrum, then sort of have more bandwidth to learn more about some of the deeper areas. And so that's my specialty. But I've been practicing that for better than 30 years now. And after I finished my training, I spent a few years in the Army and went from suburban Cincinnati life to a military base life in Fort Campbell, Kentucky, which was right next to a small town in Tennessee. Fort Campbell, Kentucky is theoretically in Kentucky because that's where the post office is, but it's on the border with Tennessee and actually mostly in Tennessee. And the immediate town is called Clarksville, Tennessee, and it's really, really similar to Richmond, Indiana in size and makeup and industry and so forth, except for the military base being next door. At any rate, we got used to living in a smaller town. When I got out of the Army in 1992, we looked at a lot of jobs in Cincinnati, I could have gone to a lot of places, but nothing felt quite right. And we just happened to learn about an opportunity in Richmond, came to visit, was very impressed, and it felt like it wasn't a big culture change from what we'd grown used to. And I knew some people here, which was amazing to me. There were some people that I had known in Cincinnati. A lot of your viewers will know Dr. Jeff Haste, who's a cardiologist in town, been here for a very long time himself. And he and I were medical school classmates, as one example of the connections that I already had here. Anyway, it felt right. So we thought we'd come here to just get started, but keep looking for that perfect job in Cincinnati, which never happened. So here we are, 28 and a half years later, and still going strong. And our kids, we've raised our kids here. So we stopped looking a long time ago. But, you know, I was in private practice for 14 years and would have just continued that way, except that along the way, I realized I was running a business. So I thought maybe I should learn something about how to run a business. And I went to night school to get a degree in business. And that was just for my own edification. I didn't really have any plans with it. But in 2006, the then CEO of Reed Health, Barry McDowell, who's a wonderful gentleman and still around a bit, a lot of people know Barry, created a position for a physician on the administrative team. And that seemed a natural fit for me. So I moved over to that role. I've been doing that since then. And really, I wish there was kind of one simple job description for what a vice president of medical affairs is. But really, when you go around to different organizations, you really find that they're a little different in various ways. There are a few functions that tend to be done by the VP for medical affairs. But at Reed, one of the things that has really been very fulfilling for me is that it's really never the same from day to day. I've been involved in a lot of different projects, and I really like that project-based work. One of the first things we did when I came onto the administrative team was we started our hospitalist program, which is well established now and everybody's used to it, but it was a brand new idea then, and it took a while to get everybody on board. But that really enabled us to be able to recruit better doctors, not to be hospitalists, but the environment in medicine had changed for primary care doctors particularly. Back when I came out of training, we all expected to work in hospitals, work in offices, work in nursing homes, go around to a lot of places and do it all. Take care of ICU patients and do minor surgeries in different places. That's not the mindset today. Most doctors these days, particularly in primary care, want to just be outpatient. A few just want to be inpatient doctors. But Reed was having trouble recruiting doctors to the old model where you had to be everything to everybody. And so we started the hospitals program to enable us to take care of the hospital patients so we could recruit more primary care doctors to outpatient practice only. And that was really a game changer. And not only did that help with primary care recruiting, but it also helped us recruit better specialists. So it had all these ramifications. So I'm really proud of the hospitals program and what that's done for Reed. And it's enabled so many things. Really, another project that I was involved in that's been very satisfying is beginning our family practice residency program, which would take young doctors right out of medical school and give them that postgraduate training that qualifies them to be fully certified primary care family practice doctors. And we've just graduated I think it's our fourth class last summer in the midst of the pandemic. And then that is going strong. We're getting better and better young doctors all the time. So proud of this young class that we've got now, 6 doctors in each of the 3 years. And it's just really amazing success. Great for us to help recruit our own doctor, recruit them to be our own primary care doctors. A few will stay, but really what it does is it establishes an academic atmosphere so that we can recruit better specialists who want to be involved with teaching programs, as an example. It's helped us up our game in the research area. We now have a developing a research institute, basically, and I'm helping roll that out. And that helps us to get plugged into some of the national studies that are being done with pharmaceuticals and medical devices, but it also supports the doctors locally who want to do their own research. It's called investigator-initiated research. Doctors have lots of ideas. Oh, I think we could study this or study that, but they don't have the wherewithal, the support, or maybe even the experience to really set that up and run it themselves. But we establish the framework within which doctors can have an idea and get assistance in carrying that out. So we've got a bunch of investigator-initiated projects. We've got a lot of sponsored projects from pharmaceutical companies and device makers. And that really is proving to be an exciting thing. And again, it helps the doctors here feel that this is not just your typical health system out amidst a bunch of cornfields. This is a high quality institution giving not only high quality care, but supporting the academic and intellectual interests of the doctors, as well as providing that smaller town life that many doctors, once they get acquainted with, really prefer to choose for their families, to raise their families in, and to enjoy the community themselves. So I think over time, we're going to see Reed move closer and closer to being a little bit like what Mayo Clinic is in Rochester, Minnesota. Rochester, Minnesota is a town that's half the size of Richmond, Indiana, but it's the flagship location for the Mayo Clinic, and everybody knows the Mayo Clinic.
Right.
And this is kind of the route that they took. They invested in things that you wouldn't expect a very small town atmosphere to have. But now look what they are. And I don't know that Reed will, maybe in the next few generations, Reed will be on that par. But I think we're kind of on a path that could lead to that. And it's really exciting.
Commissioner Ken Poust.
And I'm Angie Dickman with Reed Health, and we're all here to implore you to wear your masks, especially through this holiday season. At Reed, we really don't want you to come visit us or anybody in your family, so please wear your masks. That's the best way to stay healthy.
And Wayne County, in working with the city of Richmond, is very happy to provide the masks. We have over 150,000 masks here today. We hope to give every one of them out, and then we'll have some more to give out into the spring. Right, Dave?
That's right. We want to keep our economy flowing. We want to keep our businesses open, and we want to keep you healthy and safe. So please wear your mask, socially distance, stay healthy through 2021. Let's have a better year next year.
Happy New Year.
Happy New Year.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're having some time with Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. As an adult doctor, you've worked with a lot of seniors during this pandemic. Talk about what that has been like, because you've been working with really the group of people that have been hardest hit by this according to age.
I sure have. And, I like to say that my side hustle, I still practice a little clinically. I have a lot going on all the time, which is the way I prefer it. But one of those things that I'm very proud of is I still have a hand in clinical medicine. And I saw that there's a real need to kind of up the game locally in the care of the elderly in institutionalized circumstances. That's particularly nursing homes. We have a small team that I work with, Dr. Don Smith, and two nurse practitioners, Penny Houseman and Jessica Johnson, with little support from a couple of other of the nurse practitioners in the geriatrics office. And we take care of patients in nursing homes. Now, we've taken a lot of care to try to insulate those people from the virus. This virus is really kind of a devilish thing. It doesn't cause very much disease in younger people, yet they can spread pretty highly. I think the statistic is that under the age of about 35, the likelihood is if you get infected, you're not going to have symptoms about 80% of the time, yet you can spread. It's a kind of the reverse at the oldest age range, say age 85, where if you get infected with the virus, you're very likely to have symptoms, and they're much more likely to be severe. And the difference in death rate between age 25 and age 85 is about 800-fold. So it's just that the death rate is so low in the younger people. It's not that it's not zero. And we hear stories all the time about young people who have severe outcomes. But the reality is most young people have very minimal effects, at least acutely. The so-called COVID long hauler syndrome is a different topic. But because of that, what happens is that the younger people carrying it around and spreading it to other people, eventually that gets to older folks who are more vulnerable. We can take all the precautions we want to in terms of isolating people in long-term care facilities, minimizing their visitation, which is very hard on them. But still, they have to have contact with the outside world sometimes. Mm-hmm. At a very minimum, every day there are staff who work in facilities who come in and out from the outside world to take care of them. The pathway into the older folks in long-term care facilities is that a staff member doesn't even know they're infected, comes in. They're not taking as much precautions when they're in the community as they could. They come in, spread it behind the scenes to other staff, who eventually, even just small lapses in the protections of the patients in terms of use of personal protective equipment and distancing and so forth, small lapses will infect the residents. And this is a highly infectious virus. It doesn't take much really to infect other people. You can see that in the statistics with influenza. We saw it in the southern hemisphere during our summer, their winter, where because of distancing and mask wearing, influenza was very low in the southern hemisphere. And we're seeing that now. We have hardly had any influenza in this area yet. That doesn't mean we won't. But, I think so far it looks like we're going to have the experience like they had in the southern hemisphere. Yet we have a lot of COVID. It just shows the vast difference in infectiousness of the COVID-19 virus compared to influenza. So when young people who work with the elderly come in from the outside world and don't know they're infected, spread it to other staff, there are lapses with residents. And once it gets into the resident population, it can absolutely decimate them. Virtually every long-term care facility in this state about a month ago had, I think at this point, there's only about one or two long-term care facilities in the whole state that have not had outbreaks of COVID-19. And the deaths from COVID-19 are highly weighted to long-term care facilities. It's over 60% of deaths are from people who live in long-term care facilities. So that's a highly vulnerable population. I've been involved in taking care of them for several years. Our team has, and we've done everything we can think of to educate the staff to help with infection control practice, keep COVID-19 out of the buildings. Yet a month ago, we had severe outbreaks in the 2 buildings that we go to. It's just very hard to deal with. So that's why really the vaccine is really key to moving forward. And it requires 2 things. One is it requires, obviously, the residents themselves to be vaccinated, but that's probably not enough. We've learned that lesson with influenza. With influenza, we could get high rates of vaccination amongst the residents every year, yet still have outbreaks. And that's because the people in those circumstances have all kinds of reasons to still be vulnerable. They have chronic underlying conditions or problems or medications that affect their immune system ability to respond to infections. Anyway, when we would get high rates of adoption of influenza vaccine amongst residents, we'd still have outbreaks. What stops the outbreaks is when you get the staff to take the vaccine. And when you have a high rate of adoption amongst the staff, then influenza outbreaks are very minimal. I think we'll see a similar pattern with the COVID-19 situation. We want to get all the residents vaccinated, and that process is beginning now. The state is handling that through private companies, primarily CVS and Walgreens are sending strike teams out to long-term care facilities to vaccinate residents. They will also vaccinate staff, but we have made vaccination available to staff in our centers around the state in what's called phase 1A. They were all invited to participate. Yet so far, the adoption rate on surveys appears to be around 40 to 50% of staff have adopted the vaccine, which is very disappointing, really. We really need them to get vaccinated to protect their residents. And there are a lot of reasons for why they're not adopting the vaccine at the rates that we would like. We can talk about those, but it's the fact, and we're struggling with how to educate people to be more cognizant of the fact that we protect the vulnerable by protecting ourselves. And I think people who think that, well, that's for people who work in healthcare or assisted living facilities or whatever. No, it's really for everybody. We all have people in our lives who are vulnerable, and we have to take care of them. And honestly, the only way we can do that is by protecting ourselves. If we don't get infected, then we can't pass it on.
Providing you answers to questions regarding COVID-19. Dr. Thomas Huth, Vice President of Medical Affairs at Reed Health.
This virus is no joke.
Dr. David Jetmore, Wayne County Public Health Officer.
It's really up to our citizens.
They sit down and answer your questions on Ask the Doctors. 2 p.m. Friday afternoons on WGTV Channel 11, WCTV Channel 21, and streaming on Facebook Live.
You're watching In Focus on WGTV Channel 11. We're speaking with Dr. Thomas Huth of Reed Health about COVID-19, the vaccine, what's been going on. And the rollout of the vaccine has caused a lot of confusion among people, partially because, not that they're not paying attention, but partially because they're watching national news and they're getting information from various states and may not fully understand that this is not a federal rollout necessarily, but that each individual state is getting their population vaccinated as they choose. The state of Florida has a first come, first served basis. They've got lines literally miles long. Some people have complained that for the elderly, they need to go to a website, and not everybody, young or old, is capable of finding a website, getting scheduled. Talk a little bit about how locally you're trying to handle that and what your rules are. And Reed is moving to the Coleman Center the first of next week, so that you all are set up to be able to do mass vaccinations. Talk a little bit about that.
Yeah, it is confusing to people, and especially since there are multiple places. You know, we're now that the health department is doing a fantastic job with getting started with vaccinations at the old Elder Beerman store downtown in Richmond, and yet we're getting patients showing up to our clinics confused. They were supposed to be at Elder Beerman, and vice versa. So
Right.
there are multiple levels of confusion in all of this. And that's come about, especially since it's been opened up to those over age 80, regardless of other conditions. You know, the state has chosen to follow generally what the CDC has recommended in terms of prioritizing vaccination rollout. And I think you could go multiple ways, and a lot of other ways may be defensible. But the choice that Indiana made was that, we want to try to impact those who are at most risk. And we know that healthcare workers, compared to other portions of society, actually have higher rates of acquiring COVID-19. There's a lot of debate about whether that happens on the job or not, and how, what are the reasons for that. But the reality is, if I'm a healthcare worker, I'm interacting with people who are at risk. And so, it makes sense for a number of reasons, to start with healthcare workers. That was really the focus of the very start of phase 1A, was healthcare workers who work in high risk positions with the public or with high risk patients. And that's because, number one, if we can immunize those people, then for the next wave, should it be larger than the last, they'll be less likely to be affected with outages due to being sick. And we saw that with the last wave that peaked about the 1st of December. We had, at that point, just to kind of give a little context, we had a week or so where we had more patients in hospital from COVID-19 than we had from all other problems combined.
Wow.
More than half the hospital was full of COVID-19 patients. The challenge of that was such that we had actually set up several alternative care sites for lower acuity patients that we could move, so we could move those and create more room for COVID-19 patients. One of those, the last ditch place on campus, was our large conference facility, the Lingle Auditorium. It's still set up, but we had set it up to house 20 beds, temporary beds for overflow patients. And we came within a couple of admissions of having to use that. We came that close. We came to a razor close margin on that. That was around the end of November, 1st of December. And while we were having this very high volume of COVID-19 patients, we also had a lot of staff out sick with COVID-19. Hundreds of staff couldn't come to work. And that meant that we had high volumes with low staffing, and the people who were working were very stressed out, lots of mandatory overtime, and many people working in roles that they were kind of unfamiliar with. I mean, nurses who maybe performed roles that in one way, but they had to come and help take care of COVID patients, and that's very challenging and daunting. So my hope is that by getting as many healthcare workers immunized now as possible, when the next wave hits, and there will be a next wave, I'm sure, we will have less staff outage, and that'll just be one less pressure to have to deal with. So, we talk about the rollout, and we've concentrated on healthcare workers, and that's very appropriate in my mind. That also included offering it to staff who work in long-term care facilities. We've already talked about the adoption rate amongst long-term care facility staff. And then it was extended to be a little bit more community-facing with trying to get to people who work in positions out with the public, like in COVID testing centers, people who are going to work in our vaccination centers. And we've lately been trying to get to fire department, police, EMS, and try to, so what I would call harden them so that they're less impacted by the virus for the next wave. Now the state has opened that up to try to focus more on on the citizens who are at higher risk from severe outcomes. And we've already mentioned how that really is highly weighted to the oldest age groups. And I think the estimate is that above age 80 is it's a small proportion of the population, but it's the majority of the deaths and hospitalizations from COVID-19. And soon so we want to try to get to as many of them as possible. And there, the adoption interest is very high, but the challenge is, the whole system is confusing. How do they get registered? Do they have to go somewhere? Can it be brought to them? So there are all kinds of scenarios that have to be worked through there. Soon the state will drop that down to age 70, and then they hope to get to age 60. And then they're going to kind of reconsider from that point take stock of where we're at and figure out what they want to do next.
Do you have any feeling real quickly as to when we might see that shift down to 70, 60? Is that something that might happen by, let's say, the end of February, maybe?
I believe it probably will. We've been asking the state's been getting lots of questions. When are you going to drop it down further? They've been very coy about about being specific about that, because there are a lot of factors, one of which is, how do you get enough supply? The supplies of vaccines are still relatively limited. I mean, they're getting better all the time, but it's hard for them to project forward into when there's going to be enough vaccine supply available to be able to get the millions of people who would fall into the younger age groups. Because as we lower the age cutoff, obviously you have much sort of orders of magnitude larger numbers of people who would qualify for that. So I think the last thing they want to do is have a situation where they let they enlarge the qualifications so large, but there's not even close to the amount of vaccine that's available to serve that. And then it's just going to be whoever's clever enough to be able to get in to get a vaccine. I think that's the problem that Florida is and will struggle with by having a more inclusive approach. You can make a justification for a one come one come all approach that maybe is more defensible from a equality of access standpoint, but it just feels like it would be a very chaotic thing. So I like the way that Indiana's approaching it, trying to target those who are at highest risk. Just makes sense. And and I think that's what a lot of people would want for their elder parents and grandparents, is to make sure that they get vaccinated as early as possible. But as we've already mentioned, there are challenges in getting that done.
I know we're going to have to let you go. Talk about the Coleman Center, that setup, when it will be open, and to whom it will be open next week.
Coleman Center will be open starting January 19th is our projected start date. I think we're pretty committed to that, so I'd be very surprised if we don't hit that. Things are getting prepared now. Obviously, if you've been in the Kuhlman Center, you know it's a very large space. You can do a lot with it. The challenge we've had with our approach so far is that we've been trying to work out of the one of the office suites in our medical office building, and we can do a lot of shots in there very quickly because the shots don't take much time, but people have to be monitored for at least 15 minutes after the shot. And we can't just pack a lot of people in for their 15-minute monitoring. We have to have appropriate distancing and so forth. And so that has really been, in practice, the rate limiting step is the number of people we can monitor after their shots at one time. And so what we need is a large space where we can have people spread out. And we're kind of out of space on our campus for that. I would use the Lingle Auditorium, might be ideal for that, except that we're reluctant to take apart our temporary setup for overflow because we don't know what's going to happen in the future as far as the next wave. But if you look at the chart of our volumes over time, you can see that we've actually had 3 waves. We've never not been in one side of a wave or another since March. And therefore, we have come out of a huge wave, and we're not entirely out of it yet. But I expect we will have another, and we don't want to take apart that temporary space until we really feel like there's no chance at all of needing it. So that's why we've looked at off-campus sites, and the Kuhlman Center seemed absolutely ideal for that, and so we're going to move over there. Now that will allow us to open up our schedule much more widely. People have had trouble getting onto our schedule. Now that'll be better now with the health department's Elder Bierman plan, but they also have much more limited vaccine availability than we have, at least for now. The state is allocating to health departments a little differently than they have to the hospitals participating in 1A. But the state has asked us to also participate in what they're calling 1B. I call it 1B and beyond, which is the sequential stepping out of the qualifications into larger and larger groups of people. And one limitation that the local health departments have that we don't is that their jurisdiction is confined to their own counties. And so, every county has its own delivery site, point of delivery, or pods as they call it in the emergency management speak, that they're operating, but they have each one has limited resources, limited capabilities, limited access to the supply of vaccine. Reed, on the other hand, we're a regional organization. We serve 9 counties, and the thing that we're discussing with the state now is, could it make sense for this region to coordinate the vaccine delivery in a way that would the vision would be that we would operate a regional vaccine center that's capable of very high volume delivery for people who can drive in and walk in, and then the county health departments can take a more strategic, targeted approach to get to the homebound, to get to the parts of the communities. Like in Richmond, there are disadvantaged neighborhoods where maybe access to transportation is limited to what the public transport can provide, and maybe there are issues with have to try to work and how to fit that in, and all the challenges that come with being on kind of the edges of society. The county health departments can maybe target those populations to try to get them in place or very close to them, and we can operate a site that allows anybody from everywhere to come in and get vaccinated very quickly, and we will effectively have no limit to the number of we can do, because we can monitor a large amount of people all at one time.
You don't have that approval, so right now, if they're going to get vaccinated at your site, they still have to go through the online scheduling. Is that correct?
That's true, yes. That's one thing that Indiana's doing a little differently than some other states, is they have a one schedule that the state manages that schedule for all of the sites. And it's not completely worry-free. There are some issues with it. They're looking at changing it to a different vendor. And so we are not in control of that. And they have chosen to do it this way because right now they're the route of supply of vaccine into the state to the local outlets where it's being dispensed. And that's true for every state. It's coming from the feds to the state departments of health and then out to the vaccine sites. And what they want to do is they want to make sure that they can marry up the supply of vaccine with the schedule and make sure that's equitably distributed around the state, so that it's not all taken up by Marion County or Lake County or Allen County, which are probably the three most populous states or populous counties in the state. But it's equitably distributed so that everybody can have more or less equal access. But the only way they can do that is by also controlling the schedule, because the schedule is very complicated, because the two vaccines we have now require 2 shots each. In the case of Pfizer, it's 3 weeks after the first shot. In the case of Moderna, it's 4 weeks after the first shot. So coordinating those schedules, making sure that there's vaccine supply for the people for their first shots, and then they've got to guarantee that they can get the vaccine available for the second shots. We're not reserving vaccine for that at all. They've asked us, when we get vaccine, just dispense it all for first shots. And then they're sending us special supplies for the second shots. So coordinating all that means they've got to manage the schedule themselves and along with all the logistics so that it can stay in sync. That's the route they've chosen to take. But that means people who want to get the vaccine have got to get onto the website to get access. Now, that is a challenge for a lot of people, and not just older folks. There are a number of people in in disadvantaged parts of the community. They don't have good access to the internet and so forth. So the state has set up a 211 call system where you can just simply dial 211 and get connected to somebody whose job it is to help you get registered for the vaccine. Now, despite that, people still get confused, and so our hotline is busy every day, taking phone calls from people asking questions. How do I get vaccine? How does this work? And we will register them. The county health department, the Wayne County Health Department, also has a few people who are dedicated to answering the phone and helping people get registered. And all of the county health departments around us are pretty much doing the same thing. So we're trying to, all of us, put resources into making it as easy as possible for people to get registered. And occasionally people will just walk in as well, and that is a very tricky thing to do. We can't guarantee that we can give you a vaccine. If I don't have extra vaccine and there's somebody else scheduled to come, I can't really give it to a walk-in. But we nevertheless, if people show up and they're there and we have extra vaccine, we'll give it to them. But I don't recommend anybody do that. It's best to work through the schedule. But the reality is, to take the Pfizer vaccine as an example, it comes in a vial that's made to dispense 5 doses. But it actually, most of the vials you can get it if you're careful about drawing it up and not wasting any drops at all. You can get a 6th dose out of most vials. And, if we can get 6 doses out of a vial, we'll give 6 shots.
Right.
And so if I have a vial that comes to the clinic all thawed and ready to be used, and I've got 5 people on a schedule, but I can get a 6th dose, I've got an extra dose. So we're not going to waste that. We're going to put it into somebody's arm. We'll go and find people standing around who haven't had it, who would be interested. Or we'll take, in the case of our Richmond site, we'll take it up to a floor and give it to a nurse on the floor. So, that's trying to make all that work is tricky and complicated, because then we have to also guarantee that person can get their second shot on time, and so you can see it gets pretty complicated pretty quickly.
I know we have to let you go. Last question. You have had both of your doses.
I have.
There is a lot of feeling from people that there's microchips in it, or there's all kinds of horrible side effects. Real quickly, talk about what your side effects were, because you've had dose 1 and dose 2 of the Pfizer vaccine, I believe.
I've had 2 doses of Pfizer. That's correct. And, I'm super disappointed to report that I have had virtually no side effects. I'm disappointed to report that. The first shot, my arm was a little sore. The second shot, I didn't even feel the shot go in. I had no arm soreness. I never had a fever or a headache or muscle aches, any of the stuff that we're told to expect. I didn't have it. A lot of people I know didn't have any symptoms. That's disappointing to me to report to you, Eric, because I don't want people to get the impression that, oh, it's a breeze. This guy's guaranteeing that nothing happens, and they will go and get it and have the side effects, and then blame me for convincing them that the thing is side effect free. The reality is most people will have side effects, particularly after the second shot. And we know people who've had pretty significant side effects. I mean, nothing severe. It's just that a couple of folks I know had temperature of 101, 102, and just felt really tired and achy the day after. It lasted that day, or even only part of the day, and then they were fine. I think that's probably the opposite end of the spectrum. Most people will be somewhere in between, a little bit of side effects and not too bad. But all of it is survivable. We've not seen anybody with any severe reactions. There is a mention in the media, as we all know, that some people are having anaphylactic reactions to the vaccine. That is still a very small minority of people who've been vaccinated, but appears to be particularly people who have certain types of allergies to a component of the vaccine called polyethylene glycol, which is a component of the nanosphere that encapsulates the mRNA. Some people can be allergic to that and have this anaphylactic reaction. So we ask people who have a history of severe allergic reaction to other shots to consult their doctor first before they come get the shot. And if they are known to have allergy specifically to the polyethylene glycol or polysorbate, which is a related chemical, if they know that, or if they previously have had a severe reaction to a COVID vaccine, then they cannot get another shot, or they can't get a first one, depending on their circumstance. But that's a very small, tiny proportion of people. And lastly, Eric, my microchip doesn't bother me at all, so I don't think most people will even notice it.
Believe you did that, Dr. Tom.
I know, I went there. There is no microchip, people. Get over it.
Vice President, Medical Affairs, Reed Health, also providing information on WHIO TV Wednesday nights at 5 p.m. He's providing information on LinkedIn, providing information through Reed Health, and also every Friday afternoon, 2 p.m. on Ask the Doctors on WGTV Channel 11. I hope that we can get you back in a week or two to continue providing updated information to the community as this rollout continues and changes, and that way you can keep us up to date. So hopefully we can connect with you again.
It would be my pleasure. Anytime, Eric.
Thank you for your time today, Dr. Huth. We always appreciate you being on In Focus, and hopefully we can have you back very, very shortly. Before we wrap up this episode of In Focus, we're going to hear some words from Kim Paus, Commissioner Kim Paus. We had a chance to talk to him about the middle of last month. There's a couple of things that he had to say that I want to bring back to you. And also, in case you didn't have a chance to see it on last week's Ask the Doctors, we had a chance to get a walkthrough with Christine Stinson, Executive Director of the Wayne County Health Department, through their vaccine clinic that they have set up at the former Elder Bierman building. We'll see that coming up as we continue with In Focus on Whitewater Community Television's WGTV Channel 11.
And it's so unfortunate when you hear this story where 6 or 7 family members get together, and I know one family, I won't mention the name, 4 people out of that family got COVID-19, and the grandfather of the bunch passed away from it. And if they just had not had that gathering, or when they had the gathering, wore the mask. And what we find in the household gatherings, they think they're safe. Well, you know, Eric, you and I, we know each other. We know we're safe. We don't need to wear the mask. But yes, you do. You need to wear your mask when you're together like that. And I know in my house, my son-in-law says he's been banished from the house, from the Paust household, you know. And when I do allow him to come, he has to wear the mask. My wife wears the mask and I wear the mask. We talk for a few minutes and he's gone. And we're practicing that because the wife and I were up in age a little bit, and we're in that group that is highly susceptible if you get COVID-19. And so we've worked very hard, not only with our county annex, but especially with our public health department, with Dr. Jetmore, with Christine Stinson, and with all the members of the health department that are trying to keep you alive and safe. And I know there's a lot of folks that get very, very disturbed with us when we go out and we tell them that, you know, you can't have this many people in this, we'll just take a restaurant. And yet those restaurant tables, they have to be 6 foot apart on there, and they get very mad at us. And we don't want to close any of these businesses down. That's the last thing we want to do. But at the same time, we need your help and your assistance to work with us. And unfortunately, we have some establishments that just will not comply and work with us. And so tomorrow, well, this is Thursday, excuse me, on Wednesday, at our commissioner meeting, we'll be putting into place the 5 things that the governor has suggested that we do, of where we go in with the warnings. And we have printed forms now on citations, which we're going to have available, that if somebody is not doing that, they're going to get a warning first. But then at the end, we can, Dr. Jetmore, if he decides that they're really not complying, he can shut those businesses down. And I'm telling you, if you're late, we don't want to shut any business down. We're just telling you to comply. You can't have a party, which one that was just had 250 people at it with no mask, no social distancing. Those are not going to be allowed. And the reason for that is, you take that meant that within that group, there was probably anywhere from 20 to 25 people that were asymptomatic that's passing this COVID-19 into a lot of those other folks that are there. And that's how that spread happens on there. And so we all just have to continue to work together here. And as we do that, we'll get through this. And now with the vaccine here, and as you explained in your opening remarks, Reed Hospital is doing phase 1A. Our public health department is doing phase 1B. They've asked us to be up and to be ready by January the 4th to be able to do inoculations. And so we're beginning to work on that. We're going to be setting up for the inoculations in the Elder Bierman building. As you know, currently we're doing the COVID-19 testing, and we're also doing the flu shots. Now, I encourage you, if you've not got your flu shot, to go into the Elder Bierman on the south entrance and get your flu shot, because we need you to have that flu shot at least 2 weeks and maybe a little bit more before you're ready to get the vaccine shot. So if we get enough, and we're working towards what they've asked to do for January the 4th to be ready, so go get your flu shot now, and you'll have the 2 weeks in, and then you can get the vaccine on there. The vaccine is not a cure-all for everything, and that's one of the things that we pointed out in the health board meeting today. You're still going to need to practice social distancing and wear your mask. And if you've had COVID-19, you're not home scotch-free. Dr. Jetmore emphasized today that if you've had COVID-19, you still need to get the vaccine when it's available to you.
Hello, welcome to the Wayne County COVID Vaccination Center. I'm going to take you a tour of what it's going to be like when we open up. Right now, you've entered into our Welcome Center. There'll be a greeter sitting here that will be the first person that you talk to, and they'll kind of do an intake with you, and just to make sure that you're well enough to receive the vaccine. From there, we'll go this way. We'll have a series of mazes that the community will go through as we're waiting in line to get the vaccine. Right now, as we're only getting a couple of hundred doses to start out with, this probably won't be utilized for our first few weeks. I'd like to take the opportunity to introduce you to Chris Simons. He's the new Clinical Director of Services for the Wayne County Health Department. At this point, you're entering into the registration portion of receiving your vaccination. We'll have registration stations. A lot of times they'll be filled by our National Guard service members that are utilized in Wayne County right now. They'll flip over from the testing side over to the COVID vaccination side and help us with registration. We sure appreciate all the work that the National Guard is doing for Wayne County. Once you've been registered, then you'll just make a quick left and you'll enter into our vaccination center. And this will be where our 6 vaccinators will be stationed, ready to give you your vaccine. And then once you've received your vaccination, there's always, anytime you get a vaccine, a period of time that we want to observe you is usually 15 minutes. With the COVID vaccine, you'll be asked to stay in our recovery area for 15 minutes. Unless you've had some kind of anaphylactic reaction in your lifetime, then we'll ask you to stick around for 30 minutes. We will have some refreshments available for you in this time. We'll have a television set up, and we'll have one of our employees going over how to register for that second vaccine. With the Moderna vaccine, you'll be asked to register for your second dose 28 days after your first dose. And remember, while we're trying to get at least 2/3 of the population vaccinated, please practice social distancing, wear your mask, and avoid large gatherings.
Thanks for watching this week's In Focus on Whitewater Community Television's WGTV Channel 11. If you need to see replays of this program, they begin at 10:30 tonight, also once tomorrow night, twice on Saturday, twice on Sunday. The show will also be available on WGTV Online, our video on demand site, as well as our Facebook page. Thanks for watching. As always, I wish you well.
This episode of In Focus has been made possible through the support of the Wayne County government.
Hi, I'm Christine Stinson, the Executive Director of the Wayne County Health Department, and I'm here just to let you know that our COVID vaccine center is open and ready to serve you. So however you're receiving your information now, whether it's the radio station, the newspaper, or WCTV, or the Health Department social media page, please stay tuned and stay in touch with them. We'll be posting all of the information that way. Look for the time that we call your target population forward, and the registration links will be provided.